What's up, everybody? This is a pre-recorded video. I just did it under live, but didn't make it public. Sorry about the speech. Uh, some of you may or may not know, a couple years ago I had all my teeth removed and went the denture route. Had a little bit of luck, and then kind of went downhill from there to where I never wore them. Even after going in and getting multiple adjustments and relines and so on. But I went a long period of time and just learned how to eat food by gumming the food, which is probably not the greatest thing for you. Certain things you definitely cannot gum, so you just don't eat them. That kind of sucked. But we're not going to talk about dentures because today is day one of doing what they call all on four. So I got 4 implants on top, 4 on the bottom. I went to Nuvia Dental. The first day, and after you do your approval stuff, I'm not gonna explain that because if you got good credit, down payment, or if you just got the whole payment up front, and then after you get checked out by they send me to a laboratory to get they draw my blood, they check my weight, check my breathing, my pulse, look up your nose, your mouth, your throat, because your nasals are like literally right there, so they kind of just check them out a little bit. The hardest part was probably drawing the blood, but if you did that a bunch, you won't have a problem with it. I just don't like needles very much. But in this case, when I had dentures, I had to deal with the needles. But once you're approved and everything, you'll come back like maybe a month later, just depending on their scheduling. I think it just goes by when the surgeon's available. And to throw this out there, they're not paying me to do this. They're not taking anything off my bill. Nothing. This is just somewhere you may be able to go to if you can. If you want to try this procedure, you may see some stuff here I didn't get 100% cleaned up because I'm just now getting the feeling back on my lip. Yeah, once you're approved and everything, you come back in and you get approved, and then they're gonna go over the procedure. Everything they tell you is, I'm gonna say, spot on. If you're paying attention, they show you some videos, stuff like that. It seems like it's boring, but it is good information because you're gonna need to use it after the surgery's complete. But day one, when you do surgery, you're approved, pass the clinical stuff. They recommend where to go on that. It's not far away from them. It's in Columbus, Ohio. I will put that out there. But I think they do got places kind of scattered out. Just look up Nuvia Dental. See if there's one close to you maybe. If you want to try this out. Well, can't say you try it because once these are in, if you want them out, you're going to pay to get them out. Unless you get an infection somehow, well, unless the infection is from not cleaning, then yeah, they're not going to cover that. But if you've been cleaning, and we'll go over that here in a second, but if you do everything you're supposed to do, something goes wrong, and they got to get them out, uh, they're not going to charge you again. So I will put that out there. Uh, I think they told me that may have happened out of all the places that do this, not even including them. I think they said that's like a once in a blue moon type thing that something goes wrong. Because they do, once you're approved and everything, I mean, they're going to do x-rays and they take a bunch of pictures and show you a picture of what your teeth are going to pretty much look like after it's done. I'm not there yet, you can tell. 'Cause like I said, it's day one. Day one, first, they get the IV in you, put a mask over you, start talking to you, and then the next thing you know, you're out. I don't even remember when I went out, I don't remember the last thing she was talking about. Uh, Next thing I knew, I just woke up, and the lady that was there helping the surgeon, she was just like, "Oh, hello, you're awake. Your surgery was completed about 30." They give you an update. I kind of sat there for a second. And I tried talking because I had to go to the bathroom, and I tried to say that I had to go to the bathroom. I'm not talking like I'm a lot clearer now, but yeah, try talking right after this. I had the same experience with the dentist, though. You could barely, but she understood me. She was like, "Oh yeah, let me help you up." Well, before that, she can even get around the table to help me. I done sat up, got out of the chair, and started walking slowly, because when I stood up, I kind of got lightheaded, and I was like, "Whoa, we better slow down like a whole lot here." So I just stood there for a brief second, walked to the bathroom. That might have been 20 feet maybe. Wasn't super far away, but they were just shocked. They said they've never seen anybody literally just get up, say they had to go to the bathroom. Well, I didn't literally just get up, but I did get up pretty quickly though, like not too long after I opened my eyes. And after I said I had to go to the bathroom, yeah, because there's a lot of, the rules are similar to dentures. They tell you when not to eat and stuff when the surgery's coming up. Antibiotics, I'm not going over all that, because I think that's, you're going to find all that out if you go. But I'm just explaining, once you're in there getting ready to do it, you will get IV put in your arm. They put the oxygen over you. And remember, I said I hate needles, and oh my God, when they pulled out that IV, it wasn't a big needle. But that thing, oh, it hurt. But she told me why, because it's got like a plastic thing over the needle, and it goes in there with the needle in your vein or something. It's weird. Because I wasn't asleep yet, so she kind of explained that. And they didn't have the oxygen on me just yet. Because they get the IV in, they tell you, you might feel some coldness or something like that, or tingly, and I don't even think I felt any of that. But her and the surgeon started talking, because I think they kind of video document that, because they're going to ask you, did you take your antibiotics? Do not skip them. That's going to save your life. I only know this because I've had some bad teeth, and them antibiotics are going to save you. So just do that. You can take your ibuprofen afterwards. At least that's what they had me do. This is my friend on day one. You can see I didn't eat it all at once. I ate some, kind of took a break, and then ate some more. I'm gonna eat some more. That's real easy to eat. Applesauce. Uh, Tomorrow I may try cutting up bananas a little bit small. Uh, oh, and we're gonna get back to. Uh, but yeah, they had these mock-up teeth that they wanted to put in, so they already had these caps in because they do that right away to kind of, prevent the infection. But they got to take them off because they call them mock-up teeth. You're not going to get your normal teeth or the mock-up teeth. The mock-up teeth, they get in, they do a bunch of measurements and adjustments because what they're trying to do, and they check your bite and they take pictures. They do a bunch of shit. Uh, and even before they do all that, they hit you with another needle with some Novocaine, because your implants are pretty fresh. Even though you just woke up, some of your feelings back, so they just kind of. I hated that needle too. I felt like I was getting stung in the mouth 4 times. But I'm glad they did it because, by the end, they were taking them in and out so much, I kind of started feeling it a little bit. And they're like, oh, we can hit you with some more Novocaine. I was like, no, I hate needles. Just keep going. Because they told me they were getting close. But yeah, they check your bite, get all the adjustments they need to do. And then you're going to come in the next day. I'm assuming they tell you how to clean with the stuff you're going to get. Because you're going to get your antibiotics, everything way before the surgery. You're going to start taking your antibiotics 2 days before your surgery. At least I don't think they're going to. If they change that, they do, but they might not. So I'm not going to say that's not set in stone. Don't take the ibuprofen, though, until after the surgery, because you're supposed to take it with some food. But they're giving you like higher. It's like 600, I think, or something. I don't. And I did take one afterwards, just because I can feel just like a tad bit of pain. You can take one every 6 hours. I'm pretty close. I'm gonna take that off camera because I have a fear of swallowing pills. So yeah, we don't want to spend 10-15 minutes because I gotta take that and the antibiotic. That might be 20 minutes of me looking like a dumbass trying to swallow pills. But so yeah, and then they did this cleaning. That kind of hurt a little bit. I'm not gonna admit that. But it was real brief. They got the caps back on. They tell you again, make sure you just literally got to do this with the mouse for like a good minute. Just swirl it around, back and forth, just go all different directions. And then you get over the sink, open your mouth, and just let it come out. You're not allowed to spit for 2 weeks. Not allowed to do straw for 2 weeks. Not allowed to smoke. Nothing, because you can literally get, like when they pull your teeth out, you can get a dry socket. You can get the same thing. So, and I followed them rules the first time because I didn't want no problems. I'm definitely following the rules this time because I'm going to eat more of this applesauce off camera. And then take my medicine, go to bed, wake up tomorrow, and eat that, not go to bed, take the medicine. I'm gonna do that clean again, You know, you literally got. I think they said you got to do that literally your first 2 weeks, and then after that, you can use a water pick. You do have to get your own water pick, but if you got one, great. Uh, you finish up with their mouthwash, and I think once you run out of that, I'm gonna make sure I'm correct on this, but after that, I think you're allowed to use stuff from the store, but it can't have alcohol in it. Uh, because you know what alcohol does, right? Uh, and I think then you're allowed to spit. Uh, but the teeth will be there. And I got like a kid's toothbrush, because I think you're going to pretend like you're brushing your teeth and gently do your gums the best you can. And a kid's toothbrush is extra soft. So if you're just not applying tons of pressure, uh, I'm not sure the correct order they're going to have you do this in. It might be they're going to teach me how to floss with them in, because you can't take them out. So you got to try to go around the bars. Uh, I think they're going to show me that tomorrow. Uh, and then you just, from my understanding, you're just going to lightly brush for a few good minutes or so all over, because that's going to help kill the germs and all that stuff. And then if you're out of the mouthwash they gave you, then they said you're good to go on using, in my case, the stuff from the store. At least that's what they're telling me. If they change their mind, I'll tell you. But like I said, they're saying I'm doing real good so far. If you do this, you may be in the same boat. It's not because of being special. I think I do heal on the faster side uh, compared to some people. Cause like, you know, some people would still be bleeding, but it was the same thing when they took all my teeth out. And after I was allowed to move my gauze out after the first day, they were like, "Oh yeah, you might bleed a little bit, as long as, you know, they tell you, as long as it's not excessive bleeding, you know, like real heavy bleeding. If it's just real light, you're fine." I'm not getting nothing, just a little bit when I do that clean out. But like I said, I believe I could be wrong, but I just believe I heal a little quicker. Some people, I know I'm not the only way. I know some people, I've seen them literally get cut and and it'd be a bad cut. And 5 minutes later, you know, they ain't bleeding. I'm like, damn. And they don't even put pressure on it. But I might do a video tomorrow to show you the teeth in. And if you see my dentures, they were really white. So I did get them to match that the best they could, but I think they're a tad whiter than my actual dentures. But if you've seen my dentures in, for those that know me on the trucking side, but this video is for anybody. This ain't gonna be about trucking per se, but I get them in, and the app said that by the time I get this done and uploaded, they'll already be in. Today's August 28th, 24. I'm in Columbus, Ohio, and I literally, like I said, I went in at 8 in the morning. Right around 9:30, they started, you know, doing they checked my pulse and temperature real quick, and then they got right on getting IV needle in, and next thing I knew, I was out like a light bulb, and I don't even know how long I was out. Uh, I just know when I woke up, I want to say it was around 3 o'clock maybe. Not 100% sure. Uh, they all seem like they're cool people, knowledgeable, the surgeon, real good. Uh, Everybody that comes in there, they're trying to be very professional, is what I'm getting at, I guess, but, because they want you to feel comfortable, because they knew I was nervous. I think they saw it in me when I sat down. Even though I had teeth taken out, I didn't think I was going to be nervous, but, I never had implants put in, so this is new. Uh, I did take the one ibuprofen so far. Like I said, my lips are they're pretty close to having feeling in them now. I just got done walking around in the parking lot uh, a little bit. I didn't push myself. Uh, they just want you to go home and relax, but I'm a little different. Like, I did that for a couple hours, but I wanted to go out and walk, and I just walked real slow. I was barely got a little lightheaded at times, but it wasn't a real long period of time, wasn't real bad. Because if I would have got real lightheaded, I would have just, stopped. You just kind of know the feeling. But I walked around a good 4 or 5 times, came back in, doing this video. I definitely wasn't talking like this a few hours ago. I didn't think I was going to be talking at all, to be honest. But I was talking right away. It just wasn't great right away. I wish I would have had that on recording, because that would probably be a good laugh. But uh, I'll do at least day 2 so you can see, the teeth are going to be bolted in. I'm not going to be able to pick up an apple and eat it right away, because I'm nowhere near healing. They said at least 4 months minimum. And I may even go, just to be safe, I may even go a couple more. I mean, I'll be, I won't be doing real hard stuff, but I'll be doing more, like after a couple weeks, I'm going to be doing more than this. But for the first couple weeks, I'm going to try to do applesauce or protein shakes, or like some bananas. Uh, might not make me feel like I'm filled up, but, I don't want to mess none of this up, even though they're telling me after a couple weeks I should be able to eat hamburgers and stuff like that, but I don't know if I'm going to jump right into that. But if I do, I'll try to do a video, maybe me eating a little bit, tell you what I'm feeling, or maybe I'll just wait, because I might just go ahead and take the ibuprofen until it runs out. But they don't give you a big giant bottle of it. So I had to hit the power saver button there real quick. But like I said, if you want to subscribe to this and hit the like button, all that great stuff, that's great. I'm not asking for anybody to, but if you want to follow along, because if you're interested in doing this, you can kind of see how my journey is. There's a lot of people that did videos on it. It's called All on 4. I watched a bunch of them, and I don't know how many I watched. It was a lot. I think all of them, I maybe found 2 or 3 people that kind of hated it. But that wasn't very many, but not everybody's doing videos, so, I'm not going to say I'm going to love this necessarily, but you got to kind of take it as, hey, if it works, and I can eat food without stuff moving around or coming out while you're eating. If you got dentures, you know what I'm talking. And especially when you glue them thing out at the end of the night, you got to get, even if you put a little bit of glue in there, God, it seems like it takes hours to get that shit off. Because I was not getting the cheap glue. I was getting like the good glue with the zinc in it. And I don't know if there's really a name brand I consider real good, because none of them worked in my situation, but or it only helped for a couple bites and it broke the glue loose. That's what mainly pissed me off. But 4 months is not forever. The payments are not forever. I got 5 years on that. Just hope I can make them all. Gonna make my best attempt at it, because I got my credit fixed and we're trying to keep it that way. So if I have to get a second job, we're going there. But it is what it is. I think I can deal with it for, 5 years might seem like a long time. It is in some cases, but in this case, I'm gonna say that's nothing. You know what I'm saying? That's nothing. Especially if you've been in my boat, tried the denture thing and it didn't work. Not saying you went to the all-on-4. Some people try the snap-in dentures. I didn't want to go that route because every dentist I went to was like, don't do it. There's a lot. You have to be a lot of cleaning, changing out rubber ring. There's a lot more into them snap-in dentures. A lot more compared to the route I'm going. I want to say it's probably $20,000-$30,000 cheaper, depending on who you go to. But every night, and I did watch some of them videos, and if you get a bunch of them during the healing process, I mean, it's kind of close to this. But I mean, just the cleaning, you got to be way on top of it. Like every day, you can't skip nothing. All from what I've seen in the videos, because some of them got infections because of not doing that. Some of it was because it wasn't in the right spot or something. At least that's what they claim. So I don't know, but I'm gonna try this. Follow me along. If it goes pretty good for me, it might go good for you if you decide to do it. I'm not gonna do a shitload of videos, but I'll try to do it at least up until I can eat an apple. How about that? But I'm not gonna do them every day. I'll try 2-3 times a week, because I think every day is overkill. And yeah, I only have to, besides me doing the cleaning, I just go back. I'm going to go back to them once a year. They're going to do the first one. uh, the real professional, and because they want to look, make sure nothing weird's going on, and you're doing your part on, you know, keeping them to clean the best you can. It's just mouthwash, brush after every meal. You just gotta do it, day in, day out. Don't take too long. So this is stuff I'm just gonna take to work with me. Go in the bathroom. Boom. If I eat at work, right after I'm done, and you can't eat right after you do it, because then you're gonna have to do it again. If you want to be on top, especially after you're healed. But they did tell me on this, like after you're healed, like if you forget to clean one time, definitely get it the next day. Don't let it go for multiple days. But they want you to clean every day. But they did, they said definitely do not go multiple days. So if you miss one, uh, it's not the end of life necessarily. But I'm not, they're not telling you that in any official capacity. They're just letting you know, like, if you slip up, and it all depends what you've been eating, are you touching stuff, putting your hands in your mouth? You gotta know that stuff. If you never really mess with your mouth after touching stuff that's got germs on it, and you miss a day, you're probably gonna be fine. More like, after you're healed. But I just say don't risk it, no matter what implant you do. Stay on top of it. Uh, I'm gonna jump off here. If you got any questions, I'll try to answer them. I don't know if I have all the answers, because like I said, I'm new to the implant thing. I went through the denture thing, so I can answer a lot of questions there. Uh, I could probably even help you eat if you're struggling in dentures and they fit fairly good. Uh, I can't show you because now I can't wear my dentures, but I think I can find a link. There's a guy explains it real well, and I watched a lot of his videos, and took my grandma's advice too. And between the two of them, when they were fitting good, I mean they were both spot on. So, and just talk to people that's got dentures. They'll tell you how they eat. Like I said, some people can almost eat normal because they fit that good. But then people might have got their dentures, 10, 15 years ago. If you're new, you're going to be frustrated. Times are going to be tough. In most cases, not always, but trust me, I was there. That's why I went this route, because I just got to, hey, I can't do, and I didn't want to gum food and not wear, and I was just tired of getting the relines, this and that, just to get them to fit for a short, brief time. If this works more permanent, you're going to hear about it, trust me. I heard about it in other videos. And the dentures are made out of the strongest material known to man, so it's going to be, once I'm healed and can do a real good bite, like they're saying it's going to be pretty darn hard to break them. They're saying I could probably eat concrete, but we're not going to try that one. Even though that would make a great YouTube video, right? Like, I mean, it wouldn't be a big bite, I don't think, but maybe you can get the corner. Because once your mouth is healed with your normal teeth, you got a lot of bite down power. You just don't realize it until you get dentures. Because when you get dentures, you have to learn the control of that bite down power. And I almost got the same feeling on this. As I'm healing, I almost guarantee I'm going to go through the same thing. I'm going to have to be mindful of how hard I'm biting. It doesn't make sense now because with dentures, you have to chew up and down. Your teeth are kind of like a grinding motion. So that's why when you switch to dentures, learning how to, it's like scissors kind of. That's why you can't do giant bites at first because you have to learn, and your mouth will automatically do it. Like once you've been doing it for a minute, you don't have to think about it after a few weeks or so. I don't know. Your case, you might get it in a couple days, but and once you get the real good with little bites, do that no problem. And start out with like a soft sandwich too, a hamburger, cheeseburger. And the cheeseburger may be a little tougher, but if you do the little bites, control the bottom one with the tip the tongue the best you can. Just put it on there and leave it there. You're gonna have to force yourself at first, and you're gonna have to try to focus at first on using the muscles that are close to the bottom here. But when you're chewing on the cheese spread, just open big enough to do the bite, but don't bite down hard. Hard enough to get through just do it real slow. Hard enough to get through the sandwich, just go real slow. Once you're through, if you're chewing, whatever side your favorite to, get a little piece over here, and then try to move it another piece over with your tongue. Try to get food on both sides as you're going, and don't, just remember, chew straight up and down. And you don't have to open your mouth real because the food's already in there. So you don't have to open real big, and don't bite hard. Hard enough, just like literally touch the teeth together and just a tad of pressure maybe if you need it. But don't like, give it a real hard bite like you would with normal teeth. May sound confusing, but if you're listening to what I'm saying and you do it, it'll make sense. There's another guy that pretty much says the exact same thing, or pretty similar to it. And he even teaches you how to eat without your dentures, just in case, you need to because you just can't get them to stay in. I'll let, there may be more than one guy I'm looking for. I can't remember where he is on YouTube because he's kind of older videos. But there's a lot of videos. Just research, listen to what people are saying about eating with dentures, and including implants, because there is different implants. So, like the people with Snap-ons, they're probably going to eat real similar to a denture person, but they're going to have a little more success because they just move around a little bit. But that even aggravates some people, so just listen to people, try their ideas. Not saying mine's the best. You may find somebody that you understand what they're saying and it starts to work for you. Boom, follow it. Everybody's just out here trying to help everybody. That's the way I look at it. I don't know if I said it in the beginning, but yeah, this ain't exactly like a trucking video, but it kind of is because, everybody's got teeth, right? Truckers, no matter what field you're in. And don't worry about if people give you shit about, if you get dentures, uh, implants, whatever. It's your choice on that. If you're just trying to get back to eating somewhat normal, like I said, it won't be 100% normal because you won't, when you're chewing, you're not going to grind food like you do with your normal teeth. You don't realize you're doing it, but you are. Uh, you have to learn, like I told you earlier, though, literally you're just straight up and down. Don't grind because that's going to, with dentures, or probably all on for anything that's not your real teeth because it's probably just going to mess up something or other. Uh, I'm one step ahead. I kind of, like I said, I have a feeling tomorrow when they get the teeth in, we may try. I may be on ibuprofen, but I'm only doing the one pill maybe every 6 hours or close to it. I hate taking pills. Uh, I just do. I'm doing it because I'm afraid they're going to hurt real bad because this ain't, because they told me, I can feel it a little bit. They told me you're going to know they're there for, the first few weeks, maybe the first month. Maybe even after that, there's no guarantee. But after, but it's not going to be pain. You just might feel that they're there, but it won't hurt. But you'll feel it. Uh, I know that sounds confusing, and so I was like, does that mean I'm gonna be in pain? And they're just like, no, but you'll just know it's there. And they said maybe. That does happen with some people. They can't guarantee everything's gonna be awesome. But in most cases, uh, for most people, and they do this on a lot older people, that's like their main customer base because, well, the older people normally have like a bunch of money sitting in the bank because they saved it up. So, and they're, after the healing and everything's done, oh God, they're loving it. That they can eat anything, uh, without the teeth moving around and having to go to the dentist to try to get them fixed all the time. And, oh, they're loving it. But I did see younger people that went this route and they were saying the same thing. They maybe didn't pay for it up front, did the payments like me, but once the healing was done, uh, completely, and I'm picking up apple, whatever, hard candy, just biting it, chewing it, not like you would with normal teeth, remember, but it's so close to like having normal teeth. I mean, you could tell, like, when I watched their journey in the beginning, they were kind of like me, yeah, and they weren't getting paid to do these videos, and by the end of their healing and everything, I mean, they were a whole different person. Like, it changed them. They're different mood. They were happier. Uh, eat food again. Without big problem, because just gotta go through the process in the beginning. Like I said, your mouth. Once you teach your mouth what to do, it becomes muscle memory, including the bite down. I know this because I had the dentures, and that worked until my bone. But the downfall with dentures, your bone shrinks. That's why they got to keep doing relines, adjustments, to get them to fit real good again. Well, these implants are not the same as the little ones. They're bigger. Like I said, there's 4 up here and 4 here. After 4 months, these are going to be fused to the bone. And I don't know what kind of implant it is, but it's going to tell your bone these are teeth. And I've seen this in other videos because they put up the x-rays. They never lost bone again. Because when you got teeth in your mouth, no bone loss. Like maybe and I don't know if that means for the whole area. I didn't really look at the picture that close, but they showed, and and they were young when they got it, and I'm only a couple years in, and they had my old x-rays from the other place I tried to get this done at, and got turned down, a couple years ago. They got their x-rays, and I had a lot of bone, because they pulled it up, and this is 2 years, and it's different for everybody. Some people, and they tell you, some people don't lose bone right away. Some do. I had a feeling I would because I'm not into drinking milk, really. Don't like it, don't care for it, unless I drink it after eating cereal, or it's strawberry or chocolate. Other than that, do not give me a glass of milk. But that don't mean I'm lactose intolerant, but I'm probably close enough. But that's, my point is, nobody's the same, but some of our journeys may be similar. Um, if that makes any sense. Or maybe some of them could be dead on, you know what I'm saying? So, don't just watch me if you're trying to get this done or get information on it. I'm not going to say I'm expert by no means. I'm just telling you as I'm going along, some of the things the doctors may say to me, they're the experts. As a minimum, you can call and talk to them on the phone. They will do that too. You don't have to go in unless you really want to. But on that note, like I said, if you want to subscribe and stick around for the journey on this, like I said, I try to do, if I don't get bored with doing this, I'll try to do it. A couple videos, 2 or 3 a week maybe. 3 at the most. For at least, we'll say 6 months. Because by then, that's when I might try eating some bizarre stuff. Do a few bites just so you can see I'm not on a pain. And I'm gonna do it live. So you can't be like, oh, this is edited. I bet you were on the floor rolling around, screaming like a little girl. Oh no, we're gonna do, when we go to eat the stuff, like the apples and stuff like that, the real hard food, it won't be super live long, I don't think, but oh yeah, we're gonna do it live. It's gonna be, if you see me take a bite and everything comes out of the mouth, you're gonna see that. Hopefully you call 911 for me, even though you might not know where I live at, but at least the attempt, thank you. Hopefully, I've never seen that happen, but you never know, so. But I appreciate anybody that sticks around for this. I will do other videos besides the teeth at some point. I'm just not into this like I was a few years ago. But I thought this was pretty important, and hopefully not too terribly long. I know we're going on darn near an hour. I was trying to shoot for 20 minutes, but I was all over the place. That's my bad. Can I blame the IV? But see you on the next one. Hopefully we'll cut that one down a lot later.